Okay, this is Norway and Finland, epidemiology lecture number 4. So Norway underwent rationing during World War II, for example. And when there was rationing, decreased availability of, for example, fat like meat in the diet and dairy. There was decreased amount of cardiovascular disease, and also Roy Swank was a neurologist out of Canada, and he had looked at Norway's populations and noticed that the inland populations where they ate a lot more dairy had a lot more multiple sclerosis compared to coastal populations with less dairy. So he avoided dairy and saturated fat in his multiple sclerosis patients, and he had incredible results. He followed them for 34 years, and about 95% of them still were capable of activities of daily living. That's incredible numbers. It's an incredible long duration of follow-up. Their rationing wasn't just in Norway. There was also rationing in the United Kingdom. There was rationing in other countries in Europe. And Nathan Pritikin had access to that data, and he was very impressed by it. The fact that there was a marked reduction in cardiovascular mortality, a marked reduction in diabetes. Other persons impressed by this information were Ansel Keys, a researcher who did the 7-country study afterwards, and he correlated saturated fat, high intakes with cardiovascular disease, myocardial infarction. Lester Morrison was a cardiologist who did his own controlled study on the benefit of reducing saturated fat in the diet to reduce cardiovascular mortality. And so that's pretty much the scoop on Norway, how it led to the work of Roy Swank and how it's part of the World War II rationing data that showed that reduction in the amount of dietary fat was a dramatic risk factor for coronary artery disease, more so than the psychological stress associated with those difficult times. And once the rationing was over with World War II and these populations started moving towards high-fat diets again, their rates of cardiovascular mortality went way up. For example, in Finland, it had the highest cardiovascular mortality in the entire world. They're eating a lot of meat, drinking a lot of whole milk. And so the country, it's about 5.5 million persons, Finland. They decided to try to improve their health. And Peka Puska was the name of the physician who led the Karelia project. Karelia is like a province, big province or county in Finland where they had very high cardiovascular mortality. So he put a lot of effort into this, and this happened between especially 1972 to 1977. He would go into the communities and have educational teaching sessions, especially the wives were cooking for the families, to get them to provide healthier meals. He also tried to get people to stop smoking as much as possible, to decrease their intake of meat and dairy, increase their intake of fruits and vegetables. What they found really helped was to eat frozen berries because these were available all year round, whereas berries were previously only a seasonal thing. And the dramatic thing that came out of this was there was an 84% reduction in cardiovascular mortality in Finland. Those are incredible numbers. The blood pressures improved, there was decreased morbidity, so not only were they living longer, they were living healthier while they were alive. Their overall length of life increased on average by about 10 years. So that was an incredible, entire countrywide, dramatic improvement in cardiovascular health, showing that it's possible. And this was all done just with these steps that we talked about. So if the whole country could do it, any individual could certainly do it. So that's it.